Doctor, lots of questions from our viewers, but I want to start with a couple of troubling reports that we have seen regarding the COVID-19 vaccine. There have been concerns that a small number, and again, it's a small number, but it's still a number of teens and young adults experienced heart problems after being vaccinated. And even more recently, doctor, 7 teenage boys that I'm reading here developed myocarditis after the vaccine. Should this be worrying parents, doctor? Your thoughts?
That's a really interesting question, Olga. To answer it simply, the answer would be no. I don't believe that parents or even the children should be worried about this. And let me explain to you why. So first of all, myocarditis is an inflammation of the heart muscle, and it occurs naturally for a variety of reasons. The most common is typically a viral infection that can lead to this myocarditis and inflammation. Now, in a small proportion of patients, it can be a significant problem that can lead to a condition known as heart failure, which is a weakening of the heart. In patients who've had the COVID vaccine, we have noticed that for some reason, they start developing this inflammation of the heart muscle. But it's not exactly clear if it's related to the vaccine itself or if we're just looking for it more closely and it was going to happen to them anyway. And that's why it's important to be able to do the trials we've been doing to determine if it is an association, like it just happens to occur with vaccines, or if it's caused by the vaccine itself. In all of these cases that have occurred in the United States, there hasn't been any significant complications, and they can be treated typically with simple medication treatments that resolve it 100%. So again, to answer your question, I would not be particularly worried, but it's something that we need to continue to follow and make sure that we are all aware of this potential complication, irrespective of whether it's the vaccine or found in the community.
So definitely there is no conclusive evidence that there's a correlation between one or the other. And in your opinion, doctor, because I always like to clarify things, the benefits of the vaccine completely outweigh whatever risks, if any, at this point.
That's right, Olga.
All right. Thank you, doctor, very much. Let's move on also to the focus of today's program, which is heart disease. What are the warning signs associated with heart disease that people should be aware of, doctor?
So heart disease is a really broad category. There's different types of heart diseases out there, and I want to maybe focus on 2 that are most prevalent. They would be considered coronary artery disease and heart failure. In general, what you can expect when the heart isn't functioning as well is that patients can experience some chest pain, maybe some difficulty breathing, maybe some nausea. But again, there's other conditions that can lead to that as well. So you won't be able to make that one-to-one correlation. But typically, it's chest pain, shortness of breath, or nausea or vomiting. Interestingly enough, and I think we'll be able to cover this later, depending on your gender, you may actually present differently. But there's also a lot of different things that we can do to help minimize the risk of developing heart disease as we get older.
And I'm glad you brought up chest pain, doctor, because we just got a question in from Patrick, and he's asking this. I'm having chest pains after a night of terror. Should I see a doctor? I'm not sure what a night of terror means, but maybe it's a nightmare. That's happened to me as well, Patrick, where you wake up and you're gasping and your heart's going something like that. So I'm going to assume maybe that's what Patrick's talking about. Doctor?
Yeah. So one thing that's always important is that we're supposed to listen to the patient, right? He's clearly having some sort of symptoms. There's something that's bothering him. Whether or not it's heart related, honestly, I feel it's secondary because we need to address his concern. So let's say he sees me in the office. There's a variety of possible conditions that we're considering, but more importantly, we want to make sure that we address his concern. Typically, when people do have these extra heartbeats or this fast heart rate, as you so eloquently voiced, then we need to make sure that it's not one of these dangerous types of fast, irregular heartbeats that can lead to problems. So there's a variety of tests that we do in order to ascertain that. But ultimately, it's in the very beginning, it's a bit of reassurance with the patient that there are definitely ways in which we can better diagnose what's happening and there's lots of different treatments depending on what condition we find they have. So he should definitely seek the care of a healthcare professional, whether it's a cardiologist or the primary care doctor, and allow them to run some basic tests and do a physical exam to determine what way we should, how we should address this concern.
Absolutely. Better safe than sorry, right, doctor?
Exactly. Always keep in mind that the patient is feeling something. So you want to try to help them figure that out, whether it's that they're having something called ventricular tachycardia, which can be very dangerous, or maybe it was literally just a nightmare that caused them to just have this sinus tachycardia, which is completely benign. But you don't want to disregard their complaints. You don't want to disregard their symptoms. Take care of the patient. That's always key.
Doctor, I have a question from Dr. Despina. And let's take that question. And he has a question about lipoprotein. And let me read it for you. I've been told that I have a condition called lipoprotein little a, and that it is hereditary and can put me at a high risk for a heart attack or stroke. What is it and what can I do about it? Doctor, your thoughts here?
Sure. So, we've talked a lot about lipoprotein little a in cardiology for a long time, and really in a broader context of cardiovascular and vascular disease. So whether it's the heart or potentially even the brain that can lead to strokes. It's a protein that has been found in blood that is believed to somehow be either correlated or associated with having future blockage of the arteries, again, of the heart or of the brain. It's not 100% clear if it's an association, right, where it happens to be elevated in certain conditions, or if there are certain things that cause it to be elevated. And if we were to reduce that protein level, then we would be better off. So generally in our practice with cardiology or even neurology, we don't focus too much on it because we're not quite certain that managing it is going to make a significant clinical difference. There are other factors that are much more in protein, such as your HDL, which is a good cholesterol, LDL, which is the bad cholesterol, and your triglycerides level. We want to try to manage those three because those three have been shown to affect our risk of having heart attacks or strokes as we get older.